Good afternoon. Myself is Dr. Madhumati Varma, Assistant Professor of Medicine, JNU Medical College. My private clinic is Cosmose Health and Art Diabetic Clinic. I am a MD Internal Medicine, PhD Medicine in Diabetology and MSc in Diabetology. My phone number is 9649185144 and email address is madhumativarma@gmail.com. Today I am going to present the updates on coronavirus. As we know, day by day or every day there is some changes in the symptom and sign. Number of cases every day is increasing. Death rate is increasing. Complication is we are finding because it's a new virus and still we are studying and we are learning about it. Worldwide there is an increase of the coronavirus. 23rd April 2020, coronavirus in the world 25 lakhs 88,068 cases. Death is 1 lakh 82,808 cases. USA, Spain, Italy in the first position, then comes in UK and Germany. India still is in the low number of cases, 21,700 cases, recovered 4,325 and 686. Generally is a very low increase of number of cases and is still in the stage 2 because of Jamatis is come from the other countries. Some Nizamuddin meeting and they spreading to the all over the countries. Still community spread is very less and we hope that we will control this disease because our Prime Minister Narendra Modi is taking initiative and all ministry, public and all are cooperating and day by day they are orienting in the television media to how to control this disease and how to come out from this disease. COVID-19 is a novel coronavirus induced pneumonia, which named as a coronavirus disease in 2019 is COVID-19 by WHO on February 11, 2020. Before this, WHO was thinking that it's not transmitting human to human when it started in the China. And epidemiology is first appear in Wuhan city of China in December 2019. Still, there is a different theories how and where from where it spreads. Is under investigation. The final report to become from where it is spread, but they are telling कि they are telling कि first is appear in the Wuhan city of China by leakage from the virology lab of Wuhan, China, and is spread all over the world. Someone is telling the animal market near the virology lab in the Wuhan, China, from where it spreads. So still all this is under study from where and from which country it is spread all over the world. Novel coronavirus name is SARS-CoV-2 because it's complicated to the severe acute respiratory syndrome coronavirus. From the map you can see the North America, South America, Spain, Italy is a more red in color. Africa is less and less percentage in the India also. There was earlier also 2009 and 2012 appearance of the same type of the nosocomial or the zoonotic animal spread reservoir SARS-CoV and MERS-CoV. SARS-CoV is 58% cases result from nosocomial transmission, and MERS is 70 cases result from the nosocomial transmission. Now is appear from COVID-19. COVID-19 they are telling is spread from the chamkadar nasal secretion always this type of virus coronavirus, but they are not causing disease to the chamkadar. But when it comes to the human beings, it spread the disease. And is there is a different theories. Someone is telling that is a mutation is prepared in the virology lab of the Wuhan city of China. Pathophysiology, how it attack to the alveoli is directly goes to the alveoli of the lungs, where there is a ACE2 in receptors. A spike protein attached to that receptor and damage this cell of the alveoli and enter into the cell of the alveoli, where it membrane cell membrane of the virus is fused and the RNA is released, from where it's do a translation, transcription, and replication and packaging of the RNA in the nucleus and Golgi body of the alveoli cells. Whereas number of virus is increased, is again is coated with the cell membrane and come out from the cell and again is ready to the spread to the other cell of the alveoli. This process goes on. Is this process is damage the alveoli cell and produce a thick sticky sputum and collapse of the alveoli, which causes the because is damaging the direct alveoli. So till that damage sufficient percentage and the immunity and the strength of person is not very well, if the immunity of the person is good, health is good, they can fight with this. Otherwise, if their comorbidity or the some age related factor or the immunity is less, then they cannot fight with this virus, and a collapse alveoli is affects the secondary infection, and the oxygen exchange process. Oxygen cannot reach to the vital organ and is damaged. Lactic acid is accumulated, and brain damage, kidney, heart, and main organ is damaged. This causes multiple organ failure and ARDS. SARS-CoV-2 has four main structures: spike S, envelope E, nucleoside, and membrane M, and other accessory proteins. SARS-CoV require angiotensin converting enzyme 2 receptor to enter in the alveoli. Diagnosis generally is gold standard RT-PCR, which results come within 2 days. Is amplification of the RNA. ELISA, IgG, IgM is also coming, but because of the antigen reaction test, antigen is developed after the 7 days of the disease. Till the 7 days, they can spread the virus to in the atmosphere or to the other patients, healthy patients. So it's dangerous because it can cause a negative, false negative, or a negative test, which is harmful for the controlling or prophylaxis of this disease. After entering to the alveoli, there is a inflammatory response of cytokine and interleukins, and the macrophages, neutrophils, lymphocytes. We know that there is two type of the lymphocyte: T cell lymphocyte and the B lymphocyte. T lymphocyte by the CD4 and CD8 develops cellular immunity, and by the memory B cell and plasma cell develops the humoral immunity. Cellular immunity is the temporary and humoral immunity is the permanent. So the SARS specific IgM antibodies disappear at the end of 12 weeks and IgM uh, lifelong. This is a now is coming the therapeutic point of view, also the antigen or serum transfusion for the patients those who are sick by those people who already recovered and they have antibodies. It's the same like a passive and active immunity we are doing for the other diseases like tetanus we are doing, rabies also we are doing. Is a immunoglobulin. It's a passive immunity. Those who are do not have antibodies to fight with this disease can be taken from the person who already infected and recovered and already in the blood there is antibodies. That serum or immunoglobulin can be taken and transfused to recover these patients. Active immunity is still under the trials. USA, UK, Germany, France, they are even India, all are in third stage of the human trial. Within few months is going to appear for the general population. As in brief, the S protein is attached to the ACE2 inhibitor and enter into the cell, where it there is a other protein also NE16 non-structural protein NSP1 to NSP16. But S protein is important to enter into the cell and cause the disease. Individuals and those who are susceptible to the severe disease are elderly and the associated disease like hypertension, chronic obstructive respiratory disease, diabetic, cardiovascular diseases, HIV, and others. They can cause respiratory distress syndrome, septic shock, metabolic acidosis, DIC, multiple organ failure, CVA, CAD, etc. Symptom also they are changing their pattern. Um, Earlier they were telling there is a fever, dry cough, and breathing difficulty. Now patient is appearing asymptomatic, and when do a test, there is a positive. Some people are presenting with a complication like a scratch mark on the lower limb or the foot, CVA, symptom and sign of the acute renal disease, um, diarrhea, vomiting, pneumonia, ARDS, rhinorrhea, sneezing, sore throat. Different type of symptoms can be occur in these patients. RT-PCR, as we told, that is a gold standard, is taken from the respiratory secretion by the nasal cavity and the blood. IgM IgG is a because of the formation of antibody after the 7 days of the infection. It appears late, so can give a false negative. Investigation should be start from the CBC, all the routine tests like CBC, KFT, LFT, lipid profile, blood sugar, urine protein micro, ECG, um, mm, HIV test, X-ray. In X-ray can not all the patients, but the complicated patient can get puffy shadows, and after that followed by the HRCT can be seen the network like a hyperdensity areas in the located some lobes or the part of the lungs can be confirmatory and to see the complication of this disease. CBC in the lymphopenia. If the complication of the renal disease, KFT is altered, um, can be affect to the liver also. So lefty should also know if the patient is diabetic. We should know the status of the diabetes. ECG also very important because it affects in the heart also. When we confirm the patient should be isolated in the COVID ward, those patients are suspected to the contact should be put in the quarantine for 14 days. Mm, there is a strictly isolation ward and isolated intensive care unit for the COVID. And then supportive treatment, symptomatic treatment, because virus there is a no special treatment available, but we can give a supportive treatment like oxygen therapy, intravenous fluid according to the electrolyte imbalance or the dehydration or some other symptoms, broad spectrum antibiotic and other supportive treatment like antiretroviral, antiviral, favipiravir, ribavirin, galidesivir, remdesivir, chloroquine, hydrochloroquine, which is block the ACE2 inhibitor to enter this virus, prevents to fight with this. And symptomatic treatment, mhm, if ABC is altering, patient is dyspneic, we can give a ventilatory support, bronchodilator, um, anti-inflammatory drugs, anti-allergic drugs, etc. Prevention is social distancing is the main key. Lockdown. Um, Studies shown that those countries are following social distancing, the number of cases in the same period is more. Those who are following social distancing is less. Prevention, those who are not infected, wash hand frequently every 2 hourly with soap, 70% alcohol, and uh, sanitizer. Cover the mask when going to the outside with triple layer mask or the triple layer some cloth. Avoid touching frequently the T areas like eye, nose, and mouth. Those who are already infected, they can also should be admitted in the ward. Those who are contacted but still not infected should go 14 days of quarantine either at home or either in the places isolations where is their government is uh, fixed. There also they do all these things, wash their hand, use the mask and avoid touching 380 areas. Those who are infected should do a more precaution. Um, so in brief, transmission can be by air, um, contaminated objects, touching the doors, touching the TV screen, touching the mouse, touching the cell phone screen, droplet infection. Prevention should be using the mask, wash the hands. If there is a symptom, go to the doctor, and if there is a contact, then quarantine. If quarantine or suspected that you are going to or you have, you should be isolated completely, should not contact directly to the elderly people and the childs. Do your cloth or eating eating until wash your own by the soap, do not mix with the others. Even toilet is also sanitized day by day when using, and social distancing should be maintained. Symptom can be various variables. uh, fever, dry cough, breathing difficulty, or asymptomatic. Thank you.